so today we're going to talk about setting up a chest tube drainage system for when a physician wants to place a chest tube. We are also going to get all our supplies together to be able to support that procedure. So now that I know that we're going to put in a chest tube, I am going to get my chest tube drainage system from the invasive procedure cart. I'm going to bring that out. I am going to take my plastic wrap off, and then I'm going to open it up. It is wrapped sterilely, so I'm going to open it like I would a sterile field, like that. So here is your drainage system. I'm going to pick this up. If you look at it, you can see that there is actually instructions on the back of it on how to set it up, but I will tell you that one of the best things that you can do to start with is first just open this up, and then I'm going to turn it so everybody can look at it, but I'm going to set it up like I would. So now that we have everything ready like that, I'm going to go onto the back here where there is an ampule, a plastic container that has the correct amount of fluid in it that you will need to fill the chest tube drainage system. There's only one hole here, so I'm going to break the top of it and then I'm going to squeeze it in, and it's going to automatically fill to the right amount that should be in there. So now my chest tube drainage system is filled with this water. Next thing that I'm going to do is I'm going to make sure on the side there is a dial here that you can move this, but I'm going to make sure that it is set up to 20. So we're going to keep it on 20 right here. Now I have everything else ready. In the back here, when you take this out, this end is actually going to be the one that you're going to give to the surgeon sterilely. They are either going to use this or they are going to cut it off because it is rather big, the 5-in-1 that's on here, so you have to be mindful of that. So I'm going to turn away from this for a minute, and now I'm actually going to get my sterile chest tube tray out. So again, it's going to be wrapped in plastic. So I'm going to be taking it out of the plastic, make sure I have the right side here. And I'm going to be breaking all this plastic here, and I'm going to open it. So when you're opening a sterile tray, you always go, sorry, need a little bit more room. You're always going to go out that way first, and the last thing that you're going to do is you're going to bring in towards you. This way you don't actually touch it. So I know things are kind of, the paper is all together, that doesn't matter. We can leave it exactly like that. The surgeons can get into it because they're going to be doing that sterilely. I'm going to need some more supplies for them in order to be able to set up the tray correctly. So one of the biggest things they're going to need is a chest tube, right? Because that's what we're putting in. So we have to ask them what size chest tube they want. These are our chest tubes over here. We also have some other chest tubes down here. We have valve clips and we have Furman plurals as well. So those are other options, but most of the time this is what you're going to be using over here when you're doing an emergent chest tube. So I'm going to get my chest tube when they tell me what the appropriate size is. This is a little bit challenging to get this piece off, but you want to make sure that you get the plastic wrap off of it like this. Once it's off, then I'm going to take my cap off, and now my chest tube, wow, that's big. My chest tube is going to go on their sterile tray. So now they have their correct size chest tube. So what else are they going to need to be able to put in a chest tube? So they're going to need something to be able to clean the patient, right? So we have these little scrubbies here that you can throw on their sterile tray. Another option is, now they're not going to do it, but we can do it, is to just kind of spray betadine all over it. It depends on how fast they're going, but I would suggest we either use this, or the other thing we have is betadine swabs as well. But again, this is going to have to be opened for them to be able to grab it. So this one I think is one of the best ones because all we have to do is just open this up, and again, we can dump that out on their tray there, and they can clean their chest. Next, they're going to have to cut, so they're going to need a scalpel. There are no scalpels on the tray. I know that comes as a surprise to people, but we do want to give them a scalpel, and that's another thing we have to dump on their sterile tray. Again, notice the way that I'm dumping this stuff. I'm not touching the sterile tray. So I'm opening it away from me. This is a tegaderm. They're going to need that too when they're finishing up. So that fell on the floor, so what does that mean? I'm going to have to get another tegaderm, right? So in the meantime, I'm going to get my 5-in-1. We need another size 5-in-1 for those smaller tubes. So you'll see this, it's a bit smaller. So that's going on there. So the other thing that I need is another tegaderm, and I'm going to need some suture. well. So I'm going to get my sutures out, ask them what size sutures, throw them on the tray, and then again, we're going to try this one more time to get a tegaderm safely on there, which it did. So now I have all my supplies on there. They might ask for some other things. They might need some 4x4s. If they need some 4x4s, you are just going to, again, open up the 4x4s sterilely, put them on there. They might need a needle. Say they want to use lidocaine. They might need a needle for that. So that's over here. There's some syringes over here as well. So those are some other supplies that would be available for you. If they need chloroprep, say the patient is allergic to iodine, they have chloroprep wipes as well. Same thing, you're just going to dump it out on the sterile tray. So now all of your supplies are ready. So now while they're doing their thing, we are actually going to get the rest of our chest tube drainage system ready. So what's the last part that I have to do? I just have to connect to suction. So when I turn my suction on, I'm going to turn my suction up to 80. At least, we're going to start at 80 right there. Remember when we talked about this dial right here going to 20? If you have 20 plus 80, that's going to be 100. It's an easy way to remember it. We're going to take our suction tubing and we're going to bring it over and we're going to connect our suction tubing right onto there. And it's attached to something else or else I would show you, but it just connects right into there. There's only one place for it to connect. And now as soon as your physician is ready, remember this part here, you're going to hand this to them. They have a scissor in there. If they need to cut the tubing to put the small 5-in-1 on, they'll be able to do that at that point. So just let them cut it. They can connect. Now everything is ready. They can suture them, put their dressing on top of it as well, and all is good. Thank you.